whenever we have I think we always, I think we will try to create the achiever evidence or SLR work or TLR work based on the research questions. Okay, so here the major platform work is collect the information from the eligible articles. That's it. That's a major task. Collect the information from the eligible articles. Once we collect the information, then we will try to make it in a short, or we will try to make it in a summary point of your work. That's how the evidence will be generated with the reference of each article's reference. So we have some specific format. That format we are going to follow with the technical approach of SLR TLR work. In that SLR, we have a technical procedure, like once we have a research question, for collecting the articles we have a multiple sources, but each sources we will apply the some because criteria concept. The each criteria, I think the because criteria, I mean each criteria we will use multiple keywords for collecting the articles in from PubMed or Google source or embed or base, like that. So likewise we used to apply the keyword strategy for collecting the articles based on your because criteria stands. As per our research question right now here, the disease population is pulmonary hypertension. We are not going to consider any other population because those all will come under exclusion criteria. So in the inclusion criteria, we are going to consider only if the article has enough information related with PAH. That's it. At the same time, we are expecting, I think the intervention is not here, I think. So here we are going to connect the all intervention. And third one, we don't have any comparison here because this SLR we are going to perform for the common approved therapies, not for any particular intervention, not for any particular comparator. Because whenever I think if you have any intervention in our particular question, by the time we would have deal about comparator also. But here commonly they were asking about whatever the approved therapies right now we have in a I think in a place, or whatever the therapies cause the safety and efficacy. So those approved therapy, those all the therapies we are going to consider in our SLR form work. Likewise, the outcome we are going to consider only safety and efficacy, not even effectiveness. Okay, we are going to consider safety and efficacy. Likewise, there is no specific timing, so we can leave this. Likewise, compare we can leave. And study design is RCT. We are not going to consider any observational studies. We are not going to consider any other kind of clinical trial data studies like RWE. We are not going to look that. So what's the meaning? So we are going to create the keywords for population. We are going to create keywords for all approved therapies. It's just simple one word, all approved therapies. That's it. It's not necessary. You have to give multiple word. Likewise, we are going to create the keywords for safety and efficacy. And here also, it's not necessary to create multiple time keywords. So we can create like safety and efficacy, safety, efficacy. Likewise, we can create separate. So some articles would have safety, some articles would have safety and efficacy, some articles would have efficacy. So likewise, we are going to give all the chances. We are not going to miss any even single chance. And RCT also. But in RCT also, you would have think that only one word is enough. But no, in RCT, we would have get multiple keywords. So for understanding, for getting multiple keywords, you can use even Google also. For example, see, pulmonary arterial hypertension. If I want to collect the keywords, for example, if I would like to search in the PAH, could you please tell me the PubMed you can see now?
Yes, yes.
Okay. So for example, if you are giving only one keyword in this particular place, PubMed homepage, okay, then if you done a click search, see, you can see 28,000 articles we are getting. But this is based on only one keyword. Maybe we would have chance to miss some other keywords also, or maybe some unnecessary articles also we would have get from here. See, in the heading itself, we have here also we have a heading. This is related to pediatric, not like any kind of other people, adults or something. And even in our research question also doesn't clarify that whether it's for pediatric, whether it's for adult. So we will have take, I think we have to take both things, but maybe we can exclude based on the further discussion with the client. This go one keyword, but usually we will always do the research, that means the collect the articles from PubMed based on this advanced search. See, when you done the advanced search, it will come like this. I'm going to delete this now. I'm going to show you in the first now. See, if you click advanced, see, if you are giving the word again, the keywords here, it will show you like I think you can. So what is the use of this option? Actually, this particular box, we can apply the one kind of restrictions like in which area field in our articles you need this pulmonary arterial hypertension. See, whenever you see your articles, in the article itself, you can see multiple keywords. Okay, so likewise, which field you want, whether this pulmonary arterial hypertension should be in a heading, or it should be in an abstract, or it should be in a kind of any place in the article. That's how if you're planning to give any condition, by the time you can use this query box like a field box. All field means it will, I think it will give the articles wherever is pulmonary arterial hypertension is exist. Either it could be a reference place also, it will show the article is eligible. Likewise, that means in your search, you are going to use all the techniques for collecting available articles. That's it. Later we can make whether it's eligible or ineligible. So here, most of the time in pharmaceutical field, all the people will go with the title and abstract. If the key population, if the keyword of population, which is not available in title or abstract, mostly those articles which is not much info, which is not going to provide more information. So most 99% have a chance to go into exclusion criteria. So instead of, I think, making exclusion criteria on the particular time, eligible article time, better we would have started now itself. So it will help lots of time. That's the reason I think we always choose this term. For example, even you can give this. Okay, just click add with R. We are not going to with add with the end because we are going to give a possibility of all the chances of pulmonary arterial hypertension along with some other keyword also. Like for example, if I click add, oh, it came here. Again, I want to search with another synonyms word of this pulmonary arterial hypertension, PAH. Some paper would have, I think, stands with the PA abbreviation heading also, or kind of abbreviation explained in the abstract. Maybe we would have, I think, missed it due to this kind of keywords if we put in given a particular place. So for this, I think I'm going to give, I think, miss term. Just see. Okay, so miss major topic, miss subheading, that means medical subject headings. So in a particular paper, each articles in a pharmaceutical papers, we would get the medical subject headings. So in the medical subject headings, this keyword is available or not. So if the keyword is available, those articles will be displayed here. Likewise, it's a meaning. So if I give mess term, but don't give R, if we give and if we give and pressed and here, so what is the meaning here? We are going to use a Venn diagram concept like A intercept and then B. So which is the common sectors we have, that articles only visible. But here we need articles which are all have a pulmonary arterial hypertension. We need articles which are all have a PAH. Just remove only duplicate. That. So if you want that strategy, then we are going to use add with R. Then click search. See. So you can see now.
Yes, yes, I can see it. So what will be the output now?
The output I think is loading now.
Okay, okay.
Yeah, see this output.